will join you in the rooms that you all are already in, please, like I said, continue to type in the chat box or question box who those folks are so we can keep track of who's attending these calls. But again, thank you so much for taking the time to join us today. As you all know, we now do these network-wide webinars every 2 months. We sort of alternate them with our Learning Lab calls. And especially for those of you who are newer to the network, so our new Quality Improvement Fundamentals grads, this may be your first network-wide webinar. And just a few kind of reminders about how these are different. You know, I always hate to say this, but we do keep folks on mute for these calls. We have up to, I think we had close to 80 people on the last call. So we need to be really careful about the sort of amount of background noise. That said, you know, please put in your audio pin that was provided to you so that we can mute you or unmute you if we do have a question that you bring to our attention. You can also use the hand raise button, which I'll show you in a second if you have a question. Just because you're on mute doesn't mean that we will not necessarily have time to have you answer a question live or ask a question live. So take advantage of using that hand raise button. A reminder not to put your phone on hold. Again, even though we have folks muted, every once in a while, if somebody's not on hold, something slips through and we get to be the beneficiary of some interesting background music. So please do not put your phone on hold if at all possible. And the last reminder, again, please put in the names of your other team members if possible. Finally, this call is being recorded. Melissa, as always, will send out the slides later on today, so you will all have the slides from the call as well as the recording, so you can share it with those that you're not able to. Melissa, it does sound like there is some background noise coming from someone's line. I wonder if you can just help me troubleshoot that for a second. So very quickly, again, the hand raise button looks like this, and you are also welcome to type questions that you have right in that question box that you see on your screen. And we have a whole bunch of folks, a bunch of staff on this call that are helping to monitor that and make sure that we answer any questions. So I am excited about today's agenda. It's a little bit different than the last few network-wide webinars. It's a lot of updates and getting people up to speed on some kind of what I think are some really exciting initiatives, one in particular. We are going to start the call, of course, with this quick welcome. I'm going to spend a little bit of time on network performance and some updates on reporting. We are very lucky to have a wonderful new research coordinator, Chi-Chi, from the Seattle team, who is going to share with us some new processes that that team is putting in place around making sure that that whole team has access to the data that they need to drive improvement. So she'll be speaking for just a few minutes after I share network performance. And then I am going to turn it over to Catherine Bevins. A number of you met Catherine Bevins at the spring learning session. I'll introduce her a little bit in more detail when we get to that part of the call. But she is going to share some updates on a project that has been that you all have been hearing about bit by bit over the past 6 months or so, and that is finally coming to fruition, a project aimed at really assessing patient and family priorities for research moving forward. Steve Steiner will be sharing some updates on the survey research process in the network. I will be sharing some updates on some exciting new release coming out in 2 days around the pre-visit planning tool. And then we are going to make it a regular thing to start having some brief Learning Lab updates on these network-wide calls. It struck us at the learning session that the folks in Learning Labs really like to hear what's going on in the other Learning Labs. Today we're going to hear just 2 very brief updates from 2 of the Learning Labs, but we are going to make it a regular feature of these calls so that at least one Learning Lab representative gives a quick update on the activities going on there. And we'll end with, there's just a whole lot going on in this network these days, and we want to use this opportunity on this network-wide call to give some other updates and reminders from some of the key partners in this work, such as the Parent Working Group. So it will be a full call. We're going to speed through a lot of things, but I really see this as a chance just to, keep us connected and let you all know the latest and greatest things going on in the network now that we're over a month out from the learning session. So this is sort of broken record time. The last year or so, our remission rate has remained very steady, but I'm very excited to state that we are still, still holding steady at 78% remission, even as we have many new networks, many new teams both joining the network and many teams getting more and more patients registered. So this is a testament not only to the hard work of all of you to get all your patients in the database, but also to get more patients into remission sooner. I also just linked to this, want to let you all know just kind of a word of congratulations, and I'm not 100% sure if they're all on the call, but we have 3 of our QI fundamentals teams who actually did start entering data immediately after the learning session last month. I think that's a record. As many of you know, it often takes teams some time to get up and running after their first learning session with data entry. So I just want to congratulate our new QI fundamentals team who have really hit the ground running. And I'm very anxious to see, but also very hopeful, that as they learn from all of you who have really gone such a long way towards documenting your tools and processes around getting patients in remission, that those new teams will get ramped up, further and faster, and really, we'll be able to maintain these wonderful outcomes even as we grow all the time. So congratulations to all of you on contributing to that remission rate. I also want to share with you some data that I'm very excited about. I hope you'll all be as excited as our QI team is. We are now able to sort of behind the scenes track the usage of the automated reports that you all now have access to. And I just want to send quick kudos out to our IT team that has worked so hard to get these automated reports accessible and meaningful and something that's really at your fingertips and updated regularly. I was very excited to see that in September we just had a huge increase in the use of the automated reports. The bottom line is that every team should be using those reports at least monthly. They really are the key fundamental thing in your toolbox helping you shape your efforts. We are so lucky in this learning health system to have access to such a rich registry and measures that turn those registry data into stories that talk about how we're doing at the different centers. And so I just want to encourage you all to keep up the good work. Again, in September, we dropped down. I know August is busy, summer's really rough, but during August we only had 80% of centers that accessed any of the automated reports. So we were all thrilled to see that get back up to 90% in September after the learning session. And I certainly hope that now that many of you have gone in and started making it more a routine part of your practice again, that we'll see that hold steady in the coming months. Really the goal again is that every team has a process to make sure that those reports are being used monthly. And we have provided a checklist on the ICN Exchange that we will circulate the link again with the slides for this call that will help you go in and document who is the person responsible on your team for going in and looking at the various reports, really as a way to enhance reliability and make sure that you maintain that. So congratulations to all of you who have started to build it more into your processes. I have every hope that we'll be able to keep you all using those reports on a regular basis. So thank you again for the hard work you did in September to get that back up there. Specifically, I'm very excited about the fact that we will now be able to help you understand the percentage of your visits, your patient visits for which pre-visit planning is being done. We've done a lot of work to refine this and to make sure that we're capturing this in a way that's meaningful clinically. The bottom line, this is kind of a busy slide, and I know that we'll be starting to share these with you at the Learning Lab level. But the bottom line is that during September, which is this last 4 weeks here, you can see there was a pretty steady increase in the percentage of visits for which one of the automated pre-visit planning forms was accessed within 2 weeks of that visit. So again, congratulations on starting to get that pre-visit planning going back up in the right direction. Again, it's a wonderful tool that can really help you make sure you're meeting the needs of your patients. And we're really lucky to be able to track this and be able to help link you with centers that may have more reliable use of those tools. So you can look for a lot more discussion about this in upcoming Learning Lab calls. But again, it's just a really nice, rich source of data to help us and to help you understand how you're using them. So I would like to, we're trying to keep this call interactive even though you're all on mute. I would love it if each team could go ahead and type in the chat box who right now on your team, who sees it as their job to go in and access the QI measures report on a monthly basis or a biweekly basis or however you've built it into your process. It is perfectly appropriate and there is no judgment here if you say it is not assigned to anybody right now. What we really want to do is get a snapshot of how this is being done in the network right now so we can provide some more targeted coaching to help get it done more reliably. So I'm seeing a bunch of people type in coordinator, physician. So it's interesting because on the last call last week it was almost uniformly the research coordinators or improvement coordinators. but it's nice to see a mix of research coordinators and physicians being typed in the chat box. Certainly for the new QI Fundamentals graduates who are typing in that they haven't assigned it yet, that is perfectly appropriate. This is a great time to be connecting with other colleagues and learning from your QIC how best to build it into your process. So thank you all. I just saw the chat box light up. Thank you all for diving in and sharing with us. Immediately after this call, I want to put out a challenge. I did not get good response to this last week on the call, but I'd love to see at least a couple of teams go into the ICN Exchange discussion that we've set up for this purpose. And again, Melissa will include the link in the email after this call, and really share with us what is one thing that you learned in your review of your QI key measures this month. So was there a measure that surprised you that it's going in a direction other than it was, or just something that really got your team thinking? So I just encourage all of you, when you get that prompt from Melissa, let's have at least a few people go in there and start sharing some information about how they're using their data and how they're learning from it. Very quickly, before I turn it over to Chi-Chi from Seattle to talk a little bit more about how she's built a good process for making sure her center reviews their data, I just want to congratulate you all. We had a record response for the September narrative reports. I know we pushed you all pretty hard, but you know, over the summer there were several months where we backed off on the reporting and tried some different PDSAs, but post-learning session we wanted to get you all back on track with reporting. 52 teams submitted their reports, just fantastic. I just want to remind you all, you will see your Learning Lab come from your QI. Melissa, can you help with that background? Oh, it stopped, thank you. You will see your Learning Lab summary this week that really outlines the different interventions being done in your Learning Lab, and we pull that from those reports. I want to remind you all that the monthly reports really are a required part of network participation. They're not only for us, though, they're also for you. They're to help your team connect and reflect and really think about what you've done over the past month and where you need to go. And we continue to be very interested in knowing how to make the reporting more meaningful and easier for you. So feel free to type away in the chat box about that. Also be in touch with me or the other QICs. Our goal is to make it part of your workflow that is not cumbersome, but that is indeed helpful and helps you move your work forward. So I'm going to turn it over to Chi-Chi, who is, and I hope, Chi-Chi, that I'm pronouncing your name correctly. I apologize, and I know you'll correct me if I'm not. Chi-Chi is a new coordinator at our Seattle Center, and I asked her to share with you some of the tools and the process that she has put in place to make sure that all these great automated tools that I've just reminded you all about are put in front of their the others at the center like we all hoped that they would be. And I just wanted to kind of recalibrate you all to why we have a whole bunch of different people speaking today. As you heard us talk about at the learning session over and over, this learning health system is becoming more and more diverse. We have researchers, parents, centers, patients, everybody contributing and now teaching more and more on these webinars. So I'm going to try to be thoughtful about reminding all of you who we're hearing from. So today we're very lucky to hear from the Chi-Chi, an improvement coordinator, and later from a researcher and a physician leader who also happens to be a researcher. So many parts of the learning health system represented on today's call. So Chi-Chi, I think you are off of mute, and I would love to have you spend about 5 minutes telling us these new gems that you've shared with me that I think are very useful for some of our other teams, not only our new teams, but also experienced teams who may be revamping some of their current processes. I think you have some great tools, so I wanted to get them out.
Sure. Hey, can you hear me?
Yeah, we sure can. Let me know when you want me to go to your next slide.
Okay, we can start with the next slide. Hi, everyone. I want to introduce myself first. My name is Chi-Chi Obi. I am one of the QI coordinators here at Seattle Children's Hospital, and I wanted to share with you the way that we have our ICN weekly updates here at Seattle Children's Hospital. What we do is meet every Wednesday with the ICN team for our ICN team of care providers, as well as our IBD center team as well. And what we do during these weekly meetings is discuss how our numbers look with our QI key measures, and then we go on to establish problem areas or areas of concern or areas that we'd like to kind of pat ourselves on the back with. And then we move on to discuss ICN events, webinars like these, areas that we can improve, that sort of thing. So what you see here is basically a schematic of how I break things down for our team. What I do is I transfer the QI key measures that we have for our center and put them on, this is just a Word document, but I've made a template that I'm sure Sarah can send around to everyone after this talk. And basically, I have broken it down into all of the QI key measures. And I've highlighted areas of concern or areas that of focus at our center. So we can see that patients in sustained remission for us has been about 45%, which seems to fall below the 75% cohort measure that we use for our QI key measure. So that for us will be an area of concern, and what we'll do is discuss what patients fall under this bracket. Where are these patients? We do have a lot of satellite centers, patients coming in from Alaska, from Montana, from Wyoming, from Idaho. So we'd like to see if some of those patients are kind of lost to follow-up, that sort of thing. We also look at patients with current prednisone use, and actually that should say patients without current prednisone use. We are at a steady 93%, and we'd like to improve on that. And our bundles, we try to make sure, and I also have put the ICN key measures from the user's manual I2B2 so that others can understand exactly what a complete bundle means. And at our center, we have a dictation template that corresponds with what we enter in our ICN templates on the registry. So I try to ask for some consistency in our template and the use of the ICN registry so that we can have complete and coherent data. So that's kind of what that top part of the schematic is. The bottom part is just to encourage us to see how many patients that we've seen that are in ICN, those that we have removed from the study or have been inactivated due to age, surgery, new providers or relocations, and new recruits. And then I also talk about how many patients are enrolled and how many patients we can try to meet our 90-day goal with, and ours is set at 300, so we're going to be ramping up our recruitment processes so that we can reach that number. And, you know, this is great because this establishes an open conversation between all of the care providers, our nurses, our MAs, our psychologists, our dietitians, and everything. And so basically we use this as a point of discussion. And then the next slide. There you go. So basically what I've done is put together a list of events and highlights from webinars and points of concern for our center, such as learning session webinars. We're hoping to recruit 2 new care providers within the next 90 days. So I'd like for them to know when our next learning lab is for the Mellow Yellow team. So that's on November 12th at 2 p.m. And so we hope to get them there, that sort of thing. One thing that at our center that we're really interested in is using the cohorts that we derive for research. And when Peter Margolis and Steve Steiner spoke at the last webinar about the survey research, I made this a point of discussion at our last meeting to see if we can improve our key contacts list and to get everyone at our center involved. And so, like I said, our 90-day goals are definitely for everyone here at our center. So what we do is make sure that we're getting input from all of our IBD care providers instead of just our ICN providers. Let's see, and I guess the next slide talks a little bit about recruitment. So this is also my job. So as we spoke earlier about how QI key measures and presenting them to your centers might be a job for your QI coordinators or your physicians or whatnot, this is also my job too. And what I like to do is to, you know, not only provide awareness about ICM, but also get more patients enrolled because this is an amazing program. So what we do at our center is send out a daily GI ICN clinic patient recruitment list for the days that we do have IBD patients. And what I do is I've broken down the list into established, non-ICN established, and possible ICN recruits. What PowerChart with Cerner, which is the main EMR system at our center, does is allows me to go in and take a look at all the clinics and see how many patients we have coming in, that sort of thing. So I break them down into those different groups. And for the possible ICN recruits, I use the ICN criteria and derive patients from the non-ICN established group and see if they fit the criteria. I send this out to all care providers on the morning of each clinic, and then they provide me with feedback. Either, yes, I'll recruit this patient, or no, this patient may have issues with just being newly diagnosed and that sort of thing. And then, of course, we gauge patients that we can and cannot recruit. But overall, it's definitely helped with the awareness of ICN at our campus, the numbers, the amount of patients involved. And another thing I'd like to add in terms of recruiting patients is that this sheet actually, this paper actually goes out to an email, correct? And so once we send out these emails and patients like patient G and patient F have been established as possible ICN recruits, what I do is I have an ICN folder, which is basically just a Seattle Children's folder, but inside I have the trifold for ICN, the latest numbers for our success, that PDF file that's located online, and I have our study forms for our patients to sign for consent and that sort of thing. So they get this complete folder with all this information, and in front of and on top of that folder, what I do is write about what ICN can do for the patient. And so I write about our parent work groups. I also write about our patient advocacy councils and that sort of thing. So parents and patients alike know that ICN is something that is truly driven by them and is for them in the first place. So,
wonderful, Chi-Chi. Thank you so much for that overview. And I think, so there's one quick thing I want to say about this before we move on. And thank you so much for the time you took to share this.
No problem.
There is not a single team on this call that has not delighted me or one of the other QIPs in many ways over time, but I have to tell you that when Chi-Chi shared these tools, I was absolutely delighted for a couple of reasons, and it's the reason I wanted to spend a few minutes sharing them today. I think if you all think back to some of the teaching that you've heard us do, or that you will in the future hear us do for those who haven't, one of the things that really helps create a more reliable system is making the system visible. And I really like how Chi-Chi has created this snapshot that she shares with her providers who are very busy and may not have the time to go through the automated reports themselves. She is making the system visible to them in a way that I think seems very easily digestible and makes the system very real. So that's one thing that I wanted to flag. I think another thing is that, and I think it speaks to the last thing that Chi-Chi said about how these updates that she's sharing are really creating the sense of community for Seattle, out there on the West Coast, that they are part of something bigger, that the ICN webinar has things for them even if they couldn't all attend. And I think, so I really like how you, Chi-Chi, are bringing the learning health system into your own little QI team. So congratulations again. I know many of you have things much like this, but I liked how these three tools together told a really nice story about really pulling together the work of the center. So Chi-Chi, we will be sharing these on the ICN Exchange. Others I know can steal shamelessly. And I think, we have to move on to our next topic. But Chi-Chi, what I'd like to ask you to do in the next few minutes is just type into the chat box the amount of time you think it takes you to do, a couple of these things, specifically pulling together this data summary, because I know that's a question that people. So thank you again. We're going to mute you, but I can't thank you enough for being on today.
Thanks.
So I am going to go ahead. We're going to switch tactics a little bit, although I think the neat thing is we've been talking about data. I am so excited that we are now going to be talking about data and how they can be even more driven by the patients in this learning health system. Catherine Bevins is a researcher extraordinaire from CHOP, who I know several of you heard speak at the spring learning session about what we were at that time calling the research prioritization project, something that we've been asked to do, or that we have chosen to do as part of our PCORI work. It is now morphed into, I think, a name that I just absolutely love, the Patient Priorities Project, and I just have wonderful things to say about your logo too, Catherine, but the bottom line is that we are rolling this out. Several folks have already started getting emails about what this means to their centers and their patients and parents. So Catherine had offered to come on today, give us an update about where this has landed over the last several months since the spring learning session, and really get you all excited, just as we all are, about what this means for the ability for your patients and parents to have input into the direction of this system. So Catherine, I hope we can hear you.
I think, can you hear me okay?
I can. Melissa, I will need you to make her an organizer so I can hand her the screen. Catherine's actually going to take the screen. And I don't think I can do it unless she's in there or is an organizer. Let me see if I can do it, Catherine. Give me 1 second. Oh, there we go.
Okay. Yep, and let me just, are you all looking at my slides? Okay, great. Thank you so much for having me, and also to everyone on the call for this opportunity to share our update on this work. So I wanted to start by just kind of reminding folks or sharing with you for the first time, if you haven't seen where we've been with this, a little bit about this project, which has been named and renamed a number of times, reflecting the fact that we really wanted to get the language right around and sort of patient and family centered around how we were referring to this project now being called the learning objective and outcome sort of prioritization project. And just in terms of background information, the idea here, of course, is that, as is core to the beliefs of Improved Care Now, we want to make sure that in our learning, to achieve our learning objectives, that we're engaging patients, parents, clinicians, and other stakeholders in all phases of the learning process. And we thought about this, as many of you know, from a couple different perspectives. Largely, to use ICN phrase, to steal shamelessly from the community-based participatory research models, to focus on a couple of things, recognizing that research is really, and learning is a process, a cycle by which we need to identify questions that matter to us, come up with research methods, actually do the research, interpret the data, understand the implications, and then, through that dissemination process, identifying new questions. And one of the things we understand as researchers who are committed to fully engaging different stakeholders in the process is that we need input into what questions need to be asked so that this work can be meaningful to all of those involved. And the other point, this is one expansion since the last time I shared information about this project, we also want to ensure that the outcomes that we are evaluating in our research, that is, if we're asking questions about the effectiveness of a certain intervention, we want to make sure that the outcomes that we're evaluating to determine whether that intervention is impactful really matter to people. The truth is that a lot of times research is done where the outcomes of research, like symptom reduction or maybe quality of life or functioning for a child, are selected by the researchers with virtually no input from the people who this research is meant to affect. And so we wanted to make that change. So really, in essence, the work that we're trying to do is to target different components of this research model to get input from stakeholders at different stages. And at this stage, really focusing on identification of question and coming up with research methods and in particular outcomes that are going to enhance the meaningfulness of the work. One of the things we've realized from the top, though, of course, is that if we go to these different stakeholders groups, and by that I mean youth, parents, clinicians, and researchers, and we say, hey, what would you like to learn about? What do you need to know about the treatment and care of children with IBD or maybe diagnoses? Or what are the outcomes that you'd like to affect in your work? We're very likely going to get different types of answers. And so we wanted to be sort of cast a broad net in the groups of the folks who we include in this project, because we recognize that from the clinician researcher perspective, the learning objectives, and these are actually two that we've already collected in our pilot work, are things like how does the combination therapy dosing and maintenance of biologic work, how well, or can we do a comparison of biological preparations and different types of biological preps, and then efficacy on treating IBD. And a strong emphasis on outcomes, meaning the outcomes are likely to want to affect through their work, is really, not surprisingly, on symptoms, where that's sort of the clinician researcher perspective, but from the patient and family perspective, sometimes the questions are quite different. So here's an example of one that we pulled down from a discussion panel and Improved Care Now discussion group about different types of medication and also whether it was safe for this parent's child to have flu vaccine. And so you can see that the questions are likely to be different, of course, but I think especially the outcomes where parents and youth are more likely to say, yes, symptoms matter to me, but I'm also interested in kind of a broader range of outcomes, including functioning, subjective well-being, kind of relationships with other youth, especially, and capacities to do things in everyday life. So we need to get input from multiple people, and we have established an initial way to, we hope, to do this. And I think Sarah alluded to it a little bit. It's a web-based system that we have devised to gather input in a hopefully pretty efficient way from multiple stakeholder groups. And I just want to introduce you to the website that we'll be using to do this. And as I go through this, I'll share with you some screenshots from the site that show the method that we're likely to use. But I just want to be clear, we're learning about how to do this as we go along. So we are extremely interested, obviously, in your input, your feedback, and also your participation in this process, because it's what's going to enable us to generate the learning objective agenda, the outcome priorities, but also learn about how best to do this. And so Patient Priorities was designed to collect information from various stakeholder groups. It was designed with a lot of input from parent and youth stakeholders who helped us to understand sort of what are the approaches, but also what are the specific ways we should phrase the questions that we ultimately ask. Folks, you can go there now. It's live. You can go to patientpriorities.com, click on this, click to learn more project about the IBD Learning Project. And one of the first screens it'll take you to, and I'm showing you this so that you can get a sense of all the different ways that we've thought of that we want to make people aware in ICN about this opportunity. One of the very first questions we're asking folks in the survey is, please tell us how you learned about this project. This actually answers these questions are really important because we're learning here about one of the best ways to actively engage participants in a process that we believe will have a large impact on the work that ICN does and promotes, and the work that you all are doing too. So our intention, just so you know where this is, currently we've shared the site with several of the clinician leads from certain sites, and we're getting ready to roll it out using many of these different approaches you can see listed here within the next couple days. People just, in terms of participant types, we are involving parents of youth with IBD who are age 12, actually age 5 to, really there's no younger limit, but the parents of youth up to age 18, youth themselves 18 to 25, clinicians. And then if a parent has a child who is 12 to 17 years of age, we're engaging with the youth directly as well. The reason we're not going a little younger, although we'd love to get that feedback from younger children, is the questions, as you'll see in a moment, that we're asking are fairly complicated, and we've tried to make them as straightforward as possible, but we found that 12 years of age is about the lower level cutoff. And so people may actually get exposed to either the learning objectives question or the outcomes questions that I'll share with you in a moment. We're not asking people to do both at this stage simply because we want to be respectful of people's time. And so this is an example of one of the first questions that we would ask clinician leads, specifically about clinical uncertainties, questions about diagnoses or treatments that can't, from your perspective, be answered based on current research. And so far we've gotten some really fascinating thoughts about this. And we're simply asking people to address this question, particularly to identify questions that clinician leads feel would lend themselves to research in routine care settings, since that's the seamless transition between learning, research, and clinical care is part of ICN's approach. We have parallel questions like these about learning objectives for parents and youth. We spent a good deal of time generating these questions. One of the things we've learned is that in order to ask people to generate their own questions, which is a little bit metacognitive, we needed to have them think back to, or parents and youth leaders felt like the best way to do this was to think back to a time when in the child's disease progression, they could think back to that time, for example, when you first knew something was wrong, or when your child was first diagnosed, or when you were first diagnosed, when you had to make a difficult medical decision about your or your child's care and so on. And the reason we thought to do that was parents and youth both found it a bit easier to answer the question, what questions did you have or concerns did you have that you never really got the answer to? Here, again, we're trying to identify questions that we want to have folks prioritize and then identify as the most important questions for ICN to tackle from an investigation, either a QI or a research type application. Just to give you a sense of what we're doing with outcomes, at the moment with Improved Care Now, we're using an outcome prioritization method, and the survey that folks would have, and here again I mean clinicians, parents, or youth, is a survey that's based in something called best score scaling. And basically what it does is it shows a number of different outcomes and asks the respondents indicate of these, which are the most important to you, which are the least important, recognizing that all of these are really important, but relative to one another. Through this process, it's actually a pretty efficient way to get to a kind of prioritization or a list of different outcomes in an ordered way so that we can say, okay, among parents or among youth or among clinicians, here are the most, from their perspective, the most important outcomes. So really, when we're looking at the effectiveness of treatment, we should be ensuring that these particular outcomes are reflected. Obviously, I'm only showing 5 here, but sort of behind the scenes there are, I believe, something like 25 different outcomes that folks would be asked to rank through a series of about actually 21 of these tasks. It takes folks about 7 minutes to get through that, believe it or not. And so to give you a sense of what we can generate through that approach, this is a kind of made-up data, actually, because we don't have it yet, for our different learning objectives, and we'll be able to generate a sort of priority score for different learning objectives relative to each other. So we can say, okay, for the network, including based on the perspectives of all those perspectives that we should be considering, these are the most important learning objectives. So let's put our resources behind answering those questions that matter most to ICN's constituents. So that's the idea. We would do the same with outcomes, and hopefully this will set us up nicely to be able to move to the next stage of addressing these concerns in a meaningful way. Just to be clear, as I've said, we are now rolling out this process for Improved Care Now. We're really looking forward to learning both about the prioritization, but also the process, and very much hoping that folks will participate with this. In terms of numbers, we're hoping to involve all of the ICN centers in the learning objectives process. I should also mention that what I shared with you as an example is the first phase. Those open-ended questions are part 1 of the learning objectives, but we would then use that prioritization method where you're asked to rate 5 different learning objectives, most important, least important, as a second phase of that project. We're hoping to involve about 180 clinicians and researchers, about 3 per site, for both phases of the project, and about 150 parents and a total of 50 youth and young adults. In addition to that, we are working with a subset of ICN centers. Those are the centers that are specifically involved in the PCORI-funded PedsNet project that you may have heard about. Those groups are participating in the outcomes prioritization project as well. So looking for a slightly smaller number of clinicians and researchers per our agreement with for that project, but of course, again, most importantly, ensuring we hope adequate representation of the parents and especially youth participation as well. So just to kind of close up, and I'd love to hear your thoughts about this if there's an opportunity, or by email. Certainly contact me, please, with questions, comments, and concerns. We really want to make this engaging and useful and as easy to use as possible. And in terms of an ask, we're asking, you'll see more information for sure. I don't think you'll be able to avoid it about this project because of ICN's really extensive and wonderful communication channels. But we're asking folks to participate, of course, and also share this with your colleagues as a way to participate. There are some inclusion criteria, but the system sort of makes that clear as you're going through. It asks a couple screening questions. So if there are questions about participation or eligibility to make your voice heard in this particular project, you still go to patientpriorities.com and get more information about that. So I hope that's hope it's something everyone will have a chance to do.
Great. That's a great overview, Catherine. Thanks so much. I'm going to encourage folks to go ahead and put questions in the chat box. And Catherine, I don't know if you can stay on a bit to, we have time at the end to actually have people ask those, but we'll also make sure that they get to you via email so that you can answer them. So thank you again. I know we're all really excited about having patient and parent priorities and clinician priorities heard in more and meaningful ways. So thank you so much. So along the same vein, in the continuing the research theme, Steve Steiner wanted to share with all of you some updates on what the research committee is doing to make sure that those who want to participate in research can, and those who don't can opt out. So Steve, I will turn it over to you. Let me know as you want me to go through the slides.
Great, thank you very much. Please go ahead. So as many of you heard at the learning session, we recognize that the research of assets of Improve Care Now not only include our very large and growing and important database, but also, as Catherine just demonstrated, that the people, the community of ICN is certainly a very strong research asset. Go ahead. So the research committee has received several applications to do more survey research, but we didn't feel like we had the infrastructure quite set up to go ahead with that. We do believe survey research is important. It encompasses the views and perspectives of all members of the network. It's a great way to learn about specific issues like we've just seen, such as research priorities, patient-reported outcomes, trends in diagnosis and treatment. And then, as I said, many of our colleagues would like to undertake this type of research. It's also an opportunity for all of us to make a contribution by advancing knowledge and by help to build a better network. So this is where we need your help. As many of you who were at the learning session recall, we had a vote and we decided to create sort of an opt-in mechanism for those who want to participate in survey research. And this is now up and live and running on the contact management system. And so I am asking those of you on the call who are key contacts or coordinators or physician leaders at your centers to ask all of your providers as well as your ancillary staff if they would be willing to participate in survey research. And if they would, it's very simple. The key contact can go into the contact management system, and where I've highlighted with this red arrow, simply check the box that yes, I would be willing to get emails about research committee approved survey study opportunities. I should clarify that you do not have to receive other Improve Care Now emails if you do not wish to. For instance, many of my partners who are ICN providers but not necessarily part of the core team opted only to receive survey emails and not be part of the Improve Care Now listserv or our Learning Lab listserv. So it's easy to just specify that a provider can only receive survey study emails if that's all they would like to receive. We would invite you to include all of your center's core QI team as well as all providers. And on the key contact sheet, make sure that you clarify the credentials, whether they're MD, RN, RD, coordinator, others. That way we can target surveys that are approved by the research committee to the applicable persons. So we're getting this message out. As I said, since actually I presented this last week, we've now gone live with this change to the contact management system. So we are presenting this at webinars. We're going to get some information up on the portal as well as the public website. I put out a Loop blog yesterday for anyone who follows that about this. We'll include this on listservs, and I will be communicating, or others will be directly communicating with all the key contacts and physician leaders at every center to try and get you to opt in all of your providers and ancillary staff so we can get a robust community who's willing to participate in these surveys. And our goal is to get enough people that are willing and have opted in so we can begin allowing survey research to begin by about January 1st.
Great, thank you, Steve. Oh, Steve, are you still there?
Yes, I'm still here. Yeah, thank you, and we hope that everyone can get opted in. Appreciate it.
Thank you so much. And again, please feel free to put any questions in the chat box. I know Steve is happy to answer questions by email, or any of us can kind of link you back to the research committee to clarify this. But I think this will go a really long way towards making sure that the survey process is as efficient, meaningful, and non-cumbersome as possible, yet at the same time continuing to give those who want it access to the rich expertise that you all have. So thank you, Steve and Research Committee. This is very exciting. So very quickly, I'm going to share just a few updates that the informatics team asked me to share, and then I'm going to turn it over to Laura and Dawn, who are going to give quick updates from their learning labs. First of all, I just want to remind you all, you should have seen these updates in the digest and through potentially the research coordinator listserv if you fall into that category. But as many of you know, there will be a new release on Friday, October 17th, so in a couple of days, with new provider management functionality, new pre-visit planning longitudinal reporting, and an updated electronic data transfer interface. You'll hear a little bit more about it, but there will be a message coming out about downtime. I actually think that message came out earlier today during the morning hours when this all goes into place. So very quickly, what this means for you, and if you have detailed questions, I can link you up with the IT team. The provider management system will allow your center to associate a provider name with a provider ID. The provider IDs will be replaced with the provider name on the pre-visit planning form, so that name will be right there for you. You don't have to go back and look up which provider is which. So both on the pre-visit planning forms and population management reports, and in the electronic data transfer files, for those of you for whom that's applicable, the provider ID will automatically be associated with the provider name. So less, again, having to go back and link provider name to provider ID, hopefully making these processes easy for you. The thing that we are all very excited about is the upgrade happening in the pre-visit planning forms. The new pre-visit planning longitudinal report, as the IT folks are calling it, PVP Longe, is a new offering in the pre-visit planning sort of suite of information. You are now going to have a graphical view of longitudinal data across visits, including medications and labs. So I know many of you have been looking forward to this for quite some time. This is a little bit difficult to see on the screen, but you'll see it very soon when it comes out. What you'll basically do when you drill down to a specific patient in pre-visit planning, you will again get this graphical representation. For example, this top one, which I know is hard to read on the screen, is growth status. So you will be able to see this patient's growth status over the past 6 months, their PGA score over the past 6 months, and down at the bottom you'll have your medications and labs. So this is something that the IT folks have been working very hard on based on your feedback, and we're really excited to let you know that this is actually going to be available to you in 2 days. There will be plenty of support if you guys have any questions. As you all know, Stephanie Lowe, kind of your key IT contact, is always very happy to walk you through any troubleshooting. So again, we're happy to share this with all of you, and we can't wait to hear your feedback on how it works for you. So rounding out, we spent a lot of time on sort of research and data today, but as I said, we want to make it sort of a regular agenda item on network-wide calls to hear what's going on in the Learning Lab. As a first test of that, I had asked a representative from the Orange Learning Lab and the Yellow Learning Lab to share very quickly sort of where they are as a group and where they think they're going moving forward. Now, in a way, it wasn't fair because you all just came out of the learning session and there hasn't even been a Learning Lab call yet. But the thing that struck myself and Karen and Beth and Diane, the other QICs, was that the vibrancy and kind of the interaction that took place at the learning session in the Learning Lab huddle it's kind of gotten better at each learning session, and more information was shared. There seems to be just a growing sense of camaraderie. So I asked, we'll start with Dawn Ebach from Iowa to report quickly on the Yellow Learning Lab. I asked her to share what sort of came out of that great rich discussion and sort of what that means for the Yellow Learning Lab moving forward. And I imagine these updates will get a little bit deeper over time. But Dawn, if you could spend just about 2 minutes sharing with us sort of where that lab is and where they're going. Sorry, we need to unmute her. Just 1 sec. Oh, you should be unmuted, Dawn.
Can you hear me now?
You sure can.
Okay. So during our Learning Lab discussion, there were different tables, and it was interesting because several tables came up with the same ideas, and that was how we can involve the parents and the patients in the pre-visit planning process. Some people had different ideas. My idea was kind of finding out if there's any specific priorities that the families want to address during their visits and trying to learn that ahead of time so that it makes it easier to plan. So if, for example, they wanted to meet with a dietitian, if you knew that ahead of time, it would make it easier for us to coordinate that, or a social worker. Other groups were thinking, can we get a lot of that information we need for the SMART forms from the patients ahead of time, so that way we have more time during the visit to talk about other things. And so people were kind of discussing how are we going to do that process. One group was talking about calling families ahead of time. I've started trying to use my charts with Epic, finding that hardly any of our patients are signed in, so that's making it hard. So I've started the ones that I have email addresses emailing. And so we're just starting that process and seeing how the parents and patients like that, and if it does help make our clinic visits a little better for the patients. And that's basically what we've been doing. I don't.
No, go ahead, Dawn. Sorry.
Yeah, I think this was Kravis's. Is this Kravis?
Yeah, this is just the example that, the Yellow Learning Lab. So thank you, Dawn, for that update. There was, like Dawn said, a lot of interest in working on getting the patient and parent voice into pre-visit planning. And so what that lab did, we have a template for a PDSA around getting parent and patient feedback prior to the visit that each Yellow Learning Lab team is adapting to their use, and will report back on the November call what they're doing. For example, Travis's is here on the last screen. So when we send these slides around, you can all get kind of a teaser for what that lab is doing, and we'll be reporting the findings from that moving forward. Thank you so much, Dawn. And Laura, a quick update from the Orange Learning Lab. Let's make sure Laura is unmuted. Laura, can you hear me? Yeah, we sure can.
Okay. Our labs started out discussing group visits, and one of the members in the lab was telling us about a group visit that she had been part of. She was the patient, and it did not go well. She was not pleased with it at all. So we began addressing what happened in her visit and how we would work through those issues if we were to start having group visits of our own in our own centers. And it was really lively discussion, and I feel like we made some progress and gave some people some ideas on what to do or how they would start group visits. And we've also been working on a template for senior leader presentations. I believe it will be put up on the exchange once we get it finished. Just would give people an idea of where to go and what to do and what to say to engage senior leaders and tell them about ICN in a concise and informative way. This slide is a survey that we've sent out to the Learning Lab to see if they've had group visits, whether or not they're going to do group visits, and other things like that. And then I think the next slide is the senior, presentation. So hopefully well, hopefully everybody will be able to, or people will be able to use that as a springboard into any presentations that they have to give.
Yeah, absolutely. And like Laura said, Orange Lab has kindly agreed after they finish their work on pulling together a slide set template, we will share it on the Exchange and other people can steal shamelessly. So again, very quick Learning Lab updates. We will over time figure out how much we want to flesh those out for these calls. I would love to have folks quickly type in the chat box if they are interested in hearing quick Learning Lab updates on these network-wide calls, if it's good to hear what's going on kind of outside of your small micro community. And as you're doing that, I just want to finish up with a few last updates. The Parent Working Group had asked me to share that they are building a wonderful set of tools and resources that are particularly relevant to parents on the ICN Exchange. When you get this slide set, you will have the direct link to the document that they've created. This is actually a Word document with direct links to these tools that they're referencing. And it's a nice thing that you can kind of sit down and look at as a team and say, you know, if we want to pull up specific resources for parents, this is kind of the go-to place to see what those might be. They are building this all the time as you all add new tools and materials to the Exchange that seem relevant to parents. They are going to pull them onto this list. So again, this becomes something of a menu for, you know, what is our go-to list of resources when we want to give parents and patients tools that they can use. So I just want to congratulate Liz Zapp from Riley has really taken the lead on pulling this together. She couldn't be on the call, but has done a phenomenal job taking the lead on organizing these resources and beginning to get them pulled together in ways that will make them really easy for you all to navigate and use, so you can in turn make it easier for parents to navigate sort of this growing dynamic network. Oops. And we have two teams that have been looking for some ideas. You'll see this in the slide set too, but I wanted to get these out here. We have Alabama that has asked you all to weigh in and let them know if that you have recommendations for reminding secretaries about outside IBD clinic appointments. So that's just a call for help. And then the floating team is looking to connect with any other centers who are using the eClinicalWorks medical record. And again, you will see these questions in the slide set, and please be in touch with the QIC or directly with these teams if you know them to share some ideas. We'll also get conversations about those going on the Exchange. I want to remind you all that your 90-day goals are due on October 25th. Just a quick reminder that we are looking for SMART aims, so goals that are specific, measurable, actionable, realistic, and time-bound. Things like, I shouldn't have put June here, by December 31st, we will consent 50% of our newly diagnosed patients not consented for research. So get that number in there, make it measurable, and be in touch with your QIC if you need any help with that. I did check and see that a number of you have gone in and already entered your goals. The PAC is as dynamic as ever, our wonderful patient partners. We want you to note that they do have a new email address. This has also been sent out via the digest. They're looking for centers who want to be a sort of a partner in recruiting PAC participation. They are going to give you some tools and resources to help engage patients in the PAC if you are interested. So you can reach out to them if you would like to take part in that. They are looking for folks who are willing to give input on their new ostomy toolkit. And finally, they are doing a phenomenal job telling their stories on the Loop blog. Just as Steve earlier told us that he wrote a Loop blog posting this week, actually yesterday, our patients are telling stories in ways that just make our network and data come alive, and they're telling stories that really, I think, will resonate with your patients as well. So be sure to feel free to share those stories. And finally, we do not get to all meet as a group next month. It will be back to Learning Lab calls. I think many of us are very excited about that, although these are fun as well. But be sure to go to that ICN Exchange calendar to double check when your Learning Lab call is. You can download, you can click on your Learning Lab, and it gives you the actual calendar invite that you can download into your email calendar. And I just want to give some kudos to Melissa Mock and the others on the project management team who are continuing to make that ICN calendar just a wonderful tool and making all of us much more organized and reducing email, which I know you're all interested in. So finally, Melissa is going to pull up 2 survey questions. Thank you so much for your time. I know we went 1 minute over, so we didn't do too badly. But Melissa will pull up the questions. Thank you all in advance thank you all for being on the call, and thank you in advance for sharing your 90-day goals in the next week or so. And please, as always, be in touch with myself or your QIC or anyone else on the team if you have any questions or need anything from us. I hope you all enjoy the rest of your day. Thank you so much. And she'll pull up the second question in just a second here. Okay, thank you so much, everybody. Thank you in particular to our speakers today and to all the staff who helped organize this call, and we'll speak with all of you soon. Take care.